We are here today with Chris Shino. Tell me, do you use managed care at your practice?
Every day.
How significant is it part of your practice?
About 70%.
What are the pros and cons of managed care?
The pros, it brings more patients in. It makes them aware they have a benefit. It makes them think of coming in. It encourages them because it's not a cost to them. Unfortunately, the reimbursement, the chair time value, we have an entire billing department just to get reimbursed. Is reimbursement timely? So for the doctor, it's not always so wonderful.
The pros are that you definitely get more patients, and most patients do have some form of managed care. The unfortunate thing is the reimbursements are usually pitifully low, and you just have to see a lot of patients to make a living, and you don't get to spend a lot of time with each patient, and it just sort of leaves everybody feeling a little empty-handed sometimes,
The pros are that you can have volumes of persons coming in. Maybe they would not normally get an eye exam. The disappointing part is that it's so controlled with the cost, as low as getting $9 for something.
The pros are the more people come in, and the cons are you make less per patient.
Pros and cons are increased patient base. Cons are decreased reimbursement.
Sometimes not being able to service the patient as quickly as we would like to because there are referrals that they need, prior approvals, things of that nature. But and it also depends on the severity of what's going on and how fast they need these services.
How does this affect your private pay practice segment?
It makes the scheduling more difficult because we have to get, again, more patients in less time, and the private pay patients who really are paying, again, out of pocket, they're left with less time, and, it's just not really the best thing.
I think that we need managed care because the private patients may not necessarily afford the type of treatments that managed care will cover. So if the patient is a diabetic and they need to see the specialist, chances are that they won't, or they will end up going through the ER, or maybe a sliding scale at the hospital, which could take months. So having the managed care is better for the patients overall. Just getting through the paperwork and through the red tape is just a little bit more difficult, but it's better than, I think, not having insurance at all.
Well, sometimes it actually edges out the patients because I'll have so many from a managed care that we can't get in a patient who's self-pay who could go absolutely anywhere, and we might lose them to another, doctor that way.
Patients come in much more often. They have insurance. They realize they have it every year, every 2 years. A paying patient will probably put off seeing the eye doctor for a little while longer.
So then what changes would you make to make it even better?
Probably have it a way of not being so controlled that patients can move out of the managed care but still use their benefit, rather than having out-of-network and in-network. So put a dollar amount. If you have an advantage of $100, that's on the table, and then you get to choose what you like.
I would make it probably their website more user-friendly. Instead of me having to print up a form online and fax it over to them and hope they get it, I would be happy if I could submit the same information online and maybe have a turnaround, not necessarily a definitive decision, but a confirmation that they received it first, and then maybe someone call me or get in touch with me, whatever, email, within 48 hours if we needed to discuss what the patient needed and how we could go about servicing the patient.
Less management of care, more doctor control over the care instead of the number crunchers controlling the care.
Well, better doctor reimbursement would be lovely, but with the Obamacare and the Affordable Care Act, we're kind of all running a little scared how the future will bear out.
Well, I think if the reimbursements were higher, and if they limited the amount of providers that were around somewhat, instead of giving a contract to everybody, maybe we'd be able to actually make a living, and it would be a more pleasurable experience for everybody.
Okay, great. Thank you.
Thank you very much.